little bit of context while we get everything pulled up here. This is a ceremonial signing of a first here in the United States, legislation to transform sickle cell care. That is what we have happening out in Newport News. Let's listen in. We'll see what the status is of this event. We'll stay there if it truly has begun in full. Out to Newport News.
Filled with possibility. Every child carries dreams. Every family imagines a future for that child. Every young person plans for who they will become and the impact they will have in the world. Candis Gabriella King was no different. She was a daughter. She was a sister. She was a student, an artist, an entrepreneur, and a leader. She loved to read. She loved to write. She sang, danced, volunteered in her community, and dreamed of attending the Norfolk State University before going on to earn her doctorate in anthropology. She was known for her generosity, her bright spirit, and her habit of looking out for others. Candis left us far too soon. But there's also a lesson in her brief life. It is not simply about hardship. It is about courage. It's about joy, about the power of one life to inspire change. And I recognize, too, that that is what also makes her loss so profound. But that's when the book of Jeremiah comes in. It is a reminder that a life is not measured only by its length. It is measured by its impact. And because who Candis was, because of how she lived her life, the love of her family, the determination of advocates, and the commitment of leaders across Virginia, her legacy is already changing lives. What began as heartbreak has become a movement. What began as one family's loss has become a call to action. And what began as Candis' story will create hope in the future for countless Virginians living with sickle cell disease. As we go through the bill signings today, let us remember that Candis was more than a patient. She was more than a diagnosis. She was a daughter. She was a sister, a student, an artist, an entrepreneur, and a leader. She loved to read and write. She sang, she danced, she volunteered in her community, and dreamed of attending the Norfolk State University, before, of course, earning her doctorate in anthropology. We honor her best not simply by remembering her story, but by carrying it forward. Candis believed in showing up for others. Today, Virginia honors her legacy by doing the same. With that, it is my honor to welcome a sickle cell warrior to the stage, Ms. Ayanna Johnson.
Good morning, everyone. How's everyone feeling? This is a very exciting day that the Lord has made. I'm a sickle cell warrior myself, and every time I was getting ready to meet Candis, one of us was sick. So it's really unfortunate that she's gone way too soon, and it didn't have to happen. My name is Ayanna Johnson. I'm a sickle cell warrior, friend of Queen Candis King, and also youth legislative advisor of now the Secretary of the Commonwealth, Candy Munding King, for the past 5+ years. So it's such an honor to be here today celebrating the amazing bill that will be passed. I want to thank also my mom for being here and all caregivers, the military family as well, who has sickle cell, is someone that suffers a lot within our community and doesn't have the pillars that we need always to succeed. Having a bill like this put in place is something that needed to be recognized a long time ago, and it's so important that we get to make sure that this act is fulfilled today, not only for Candis's legacy, but other fallen warriors that we have lost and other legacies and stories that we continue to carry on. This act represents hope for families across the Commonwealth, and I'm honored to stand in support for its mission. I'm a 501c3 nonprofit owner and entrepreneur. I'm also a student athlete. I've been a dancer for 16+ years now. So I always say, I may have sickle cell, but sickle cell will never have me. I want to thank the governor for being here today to honor us warriors, how important and powerful our stories are, how important and powerful our mission is, because the fight is not over until it's over. So I want to thank you all for being here today, continuing to fight for us, for warriors, for the caregivers, for the military family, for all warriors that we have lost, and for all the warriors that we're going to continue to celebrate through this and through many, many more to come. Thank y'all so much.
And now the Honorable Dolores McQuinn.
Good morning. Good morning again. It is a good day to be a Virginian, and it's also a good day to be in Newport-News. And Mamie Locke and Sia allowed me to come here, so thank you. To our governor, who we just honored today, and for her presence and always being there to help support the cause, we thank you. To Secretary Munden King and her handsome husband, to my colleagues and sickle cell advocates and healthcare professions, thank you for being here and for your continual commitment to this critical work. You know, as the chairperson for the Sickle Cell Caucus, I am elated that we have created a platform to help educate, advocate, and make aware of this critical challenge that people are dealing with every day. But today is a significant day as we honor the important work of the Queen Candis for Sickle Cell Act. That is such an awesome moment in Virginia. The legislation passed by the General Assembly this year. This act is the most comprehensive sickle cell package in the country and serves as a significant milestone for the Virginia sickle cell community. It is a model. This moment is deeply personal for me. Queen Candis was a special young lady whom I knew and loved, and she had an impact on my life that I will forever cherish. Her strength, her courage, her spirit continue to inspire this work and the commitment behind this legislation. Now, I wanted to use a scripture as I shared with her mom and dad when she passed, and just trying to console them. And the scripture talks about, as Jesus is saying that Satan's desire to Peter, Satan's desire is to sift you like wheat. He said, but I have prayed for you. When you are strengthened, when you turn, when you're converted, when this changed, then you can strengthen someone else. This is the work that is happening right now. Other people are being strengthened. Others, our lives are being saved. This work is going to allow thousands of people, not just in the Commonwealth of Virginia, but across this nation, to live a better life, those who have been living with sickle cell. Thank you, Candis, Queen Candis. Sickle cell disease impacts individuals and families in profound ways, and this work ensures greater awareness, education, and support, again, across this Commonwealth. I am pleased to have sponsored House Bill 1418, the Sickle Cell Trait Awareness and Education Program Act, which will direct the Virginia Department of Health to establish an awareness and outreach program. Together, these efforts reflect our shared commitment to improving outcomes and strengthening resources for those affected. Again, I want to thank the advocates, the healthcare professionals, families, and colleagues who helped bring this work forward. And to both of you, my friends, who I love so dearly, thank you for turning your pain into joy for someone else. God bless you.
Getting a workout this morning. Next is Dr. Daphne Basil, Medical Director for OBGYN Bow and Secures.
Good morning, everyone. I have hard steps to follow after two amazing individuals before. So good morning again. My name is Dr. Daphne Bazil, and I'm a practicing OB in Petersburg. When I first learned about the work that was being done, my first response was yes. Actually, it was like, heck yeah, but it was yes. When you walk into my office, the first thing most patients will see is a sign that I created that says, healthcare is a right and not a luxury. So today is a great day because healthcare should be free of unconscious and learned bias that sadly many of my colleagues in medicine may not realize that they have. And because of these thoughts, much needed research is not being done. Day to day, I see the impact that this has on maternal health, on fetal and infant health. It's in the management of a recent patient that has pregnant and had a history of migraines that was being discharged. And I said, pause, stop. Let's get a head CT. I was even questioned by a fellow colleague why. She has migraines. Turned out she had bilateral bleeds in her head and an AV malformation that would have killed her and her unborn child. I've seen it in my pregnant patients with sickle cell who've come in agonizing pain, chest pain, and immediately some thoughts are she's pain-seeking. And in fact, another life-threatening condition, she had acute chest syndrome, another mother that could have been lost. Whew. Had to take a moment there. All of this results in misdiagnosis, delayed in care, and sadly, again, the loss of patients. Medicine, the art of healing, is more than black and white. It encompasses a multitude of beautiful colors that often require multiple eyes and many pauses and many stops just to look and see your patients. I am pleased to have contributed to some of the amazing work. I want to thank the Virginia Interfaith Center for Public Policy, the PUSH Coalition Legislative Advocacy, the honorable delegates, our Secretary of Health, the King family, and our wonderful Governor Spanberger for making today possible and another step to a healthier Virginia. Thank you.
Dr. Michael Hooper.
Hello, everyone. It is such an honor to be here with you at the Sentara Community Care Center in Newport-News, a facility that was built and started to address care needs in a community, care needs that weren't being met. And that's exactly what you all are doing with the legislation that you forwarded here today, is to close a care need in a population in Virginia that desperately needs it. So my hat is off to everyone in this room that has worked tirelessly in that effort. I am Michael Hooper. I have had the privilege of serving our community as a physician and now as the Chief Clinical Officer at Sentara Health. It's wonderful to be here with fellow healthcare providers. I see many in the audience. I know how hard people work every day to improve the health of the community. Community leaders, colleagues from Sentara, our Sentara Health President and CEO, Dennis Mathis, distinguished members of the General Assembly, Secretary Candy King, other family members of Candis King, and Governor Abigail Spanberger. Each of us are programmed by DNA, our genetic code. We all have somewhere around 3.1 billion base pairs that make up our genetic blueprint that determine so many things about us. The cells in our bodies come from this programming, and it brings about beautiful diversity in our populations and our communities. But one single misstep, one single difference in that can create a disease like sickle cell. And that difference can shape an entire life. Sickle cell disease, as you know, disproportionately impacts African Americans. for around 4,000 Virginians through no fault of their own. This means living with episodes of severe pain, hospitalizations, and the constant threat of a serious or life-threatening complication. The disruption to the lives of these children and adults cannot be overstated. It's our collective responsibility as a community and as an industry to address this, to remove the barriers of care and improve the outcomes for these patients. Improving care for diseases requires awareness, expertise, investment, and discovery. And that is very evident in the Hampton Roads community, which has one of the highest rates of sickle cell in Virginia. For too long, these patients have faced limited access to specialized care, and Sentara recognized the urgent need. We consulted with other sickle cell centers in the state, including locally at CHKD and nationally, who welcomed us with open arms. And in 2024, in partnership with Virginia Health Sciences at Old Dominion University, we launched the Sentara EVMS Comprehensive Sickle Cell Program. That's the first adult program of its kind in Hampton Roads. Following best practices in multidisciplinary care, including primary care, pain management, behavioral health, physical therapy, we're able to now create comprehensive, personalized care plans for these patients so that they don't have to wait multiple months to get the care that they need and that they deserve. These efforts by members of this audience have improved the health of over 200 of your neighbors, family members, and loved ones. Today's event is bigger than any one program or organization. It represents progress for individuals and families who are affected by sickle cell, and a stronger commitment to improving the lives and healthcare across Virginia. When I speak to young physicians, medical students, residents, fellows, nursing students, nurses, I often talk about the fact that patients that you meet in your career will travel with you. They will become permanently a part of you. Some of those will be good stories when you've had the chance to save a life, to extend a life, to prevent permanent illness or disease. And some of those are tragedy and loss. But all of those patients that travel with us help us become better in our profession. Because no matter how many books you study or tests you take, you can't gain empathy except through human experience and human interaction. These patients that travel with you help you understand not just the disease, but what it feels like to carry the burden of that disease day to day. We're not just here to celebrate a legislative achievement, but to remember the patients that inspired it, the patients that travel with us. To remember Candis King. I didn't have the pleasure of knowing her, but I'm told she was a gifted singer, a dancer, a proud member of her high school color guard, and above all, deeply cherished and loved by those around her. The journey of Candis and her family can teach us about the profound love and the extraordinary challenges that come with sickle cell. I know that through learning about her, her story will travel with us forever. Thank you all.
Please join me in welcoming to the stage the Honorable Mamie Locke, Chair of the Virginia Senate Democratic Caucus and Co-Chair of the Virginia Black Maternal Health Caucus.
Good morning, and welcome to the 23rd Senate District. To Her Excellency Governor Spanberger, Secretary Munden King, and all gathered here, welcome. Senate Bill 22 has been 6 years in the making to address implicit bias and the lack of cultural competence in our healthcare system. I didn't just wake up one morning and decide there's bias in our healthcare system. My best friend since we were in the 8th grade, older brother died from sickle cell disease. I didn't know why he was always sick. Didn't know why he was in and out of hospitals, why he was always in pain. He had a late diagnosis. And he was diagnosed when he was about 10. And he died at age 27. She has the trait. And we learned later on that he actually was sick all the time. But why? I mean, he was just a little black boy, you know, in and out of hospitals, always in pain. So, you know, what the heck? So he finally got the diagnosis when he was 10, but no one really cared about that and about this young black boy with sickle cell disease. Another issue that kind of spurred me to want to do this work was my sister. After giving birth to her daughter, the doctor walked out of the room, leaving her in distress and bleeding. He had not removed the placenta. If not for the quick actions of the nurse, she would have hemorrhaged. And stories of my own misdiagnosis that landed me in the Careplex Hospital ICU. Those stories and stories of countless other people, from healthcare individuals who simply do not listen to the pain, and stories of individuals who say, I'm in distress, you know, I'm in pain, I have an issue, and those stories are simply dismissed. The stories of misdiagnoses in maternal and other health care for African American families is what brought me to this work. Senate Bill 22 requires bias reduction training, and its becoming law recognizes health disparities and will save lives. I want to thank the Interfaith Center for Public Policy and Catherine. Catherine, please raise your hand. We've been on this journey for many, many years. Thank you so much for standing with me and working with me all this time. And we've made it to the finish line. And for all of the advocates who have been in this work with me, thank you so very much. And I want to thank you all for being here today to help us through this journey.
Please help me welcome to the stage the parents of Queen Candis Gabriella King, Joshua and Candy King.
"239 days ago, I came before this body and I asked you to pass comprehensive sickle cell reform, and here we are. The bills are getting signed today, and I'm thankful. But what does this really mean? It means that children and adults with sickle cell will have the ability to adequately advocate for themselves. My daughter Candice was a strong sickle cell advocate. She knew all of her medications, her blood count numbers, and her treatment options. She knew what to do when she had a sickle cell emergency, and she knew how to educate doctors, school nurses, and others. 239 days from now, I want every sickle cell warrior, doctor, and nurse in the Commonwealth to have the same confidence that Candice had when she advocated for herself. Thank you for all the hard work in putting this event together, and I hope to see you again as we travel down this road for a cure for sickle cell for all.
Good morning. When Candice was born, her dad looked at her and said, "She's perfect." And almost every day he would tell her that story. You're perfect, you're perfect. And she is. She brought us so much joy. She was so feisty and so funny. So Delia Ward said, you got that right. She was so feisty and so funny. She was a gift. And it has not been easy to do this work in her honor. It has not been easy to watch our friends and loved ones with sickle cell fight this battle. And I would be remiss if I did not recognize the tremendous loss of Dewan Stiegel. Dewan, in his 20s, was diagnosed with a rare and aggressive form of cancer that is directly related to sickle cell trait. And he lost that battle, but he spent his last year in chemo and in treatment, raising awareness that young black men with sickle cell trait are not symptomless. They are not expendable. Just because it's rare does not mean that they don't matter. And that's what today is about. We're so grateful to lift Candis's name, but this is about all the children who have been ignored. All the things that a simple early screening can detect and give them a chance. For the funding, this is about them. So we are so grateful for all the love and support, and none of this would have been possible, first, without the entire General Assembly. So please stand up. That's you too. Without our family who is here, y'all stand up. And without community partners willing to work together, not care who got credit, but cared about moving this issue forward. So we are so grateful, and I'm ready to get these bills signed. So thank y'all so much. And I mean, what can I say about my boss? The governor has made sickle cell disease a priority throughout this entire administration. We have worked day in and day out under the leadership of Secretary Figueroa to ensure that sickle cell warriors know that they are not forgotten, that they have a seat at the table. And so thank you, Governor Spanberger, for your leadership on this. We are forever grateful.
Please help me in welcoming the Speaker of the Virginia House of Delegates, the Honorable Don Scott.
They don't know nothing about that. We'll explain that to you later. Good morning, everyone. It is an honor to be here today as we sign the Queen Candis Hope for Sickle Cell Act and take another important step forward for families across Virginia. I want to begin by recognizing my friends, Joshua King and Candy Munden King. You have to understand how incredibly difficult it is to have to bury a child. I remember the night of the morning of October 5th. I'm lying in my bed, my phone is blowing up. My wife thinks I got a side joint calling me. Phone blowing up. I finally, y'all get that, y'all calm down. I finally answer the phone. Who is that? I answer the phone. It's my former chief of staff, Phil Newell. He's crying. He says, she's dead. I'm like, who? He says, Candis. I call Candy, she didn't answer the phone. I called Josh, he answered the phone. They told me what was going on. I jumped in my car and I drove to Prince William and I went to meet them where they were. And as you can imagine, they're devastated. They're in shock. But what I remember, and they needed a ride home, so I'm glad I got there. They were at the hotel across the street from the hospital. But what I remember about them that was so amazing, and the reason why I think we're all here today is because they said she will not die in vain. Our baby's name will live on. We will fight for her. That is what brought us here today. So this legislation is about people having hope in a moment of despair. They could have easily folded up their tent and went home, but they stayed here in the middle of this fight. You know, there's a line from The Shawshank Redemption, one of my favorite movies, that says, hope is a good thing, maybe the best of things, and no good thing ever dies. Queen Candis was a good thing, and so she can never die. So I want to thank all of my colleagues, first of all, who have been fighting this fight for a long time. Delegate McQuinn and Senator Lucas and Senator Locke, Delegate Sewell, Delegate Hayes. They've been standing up fighting for these communities that have been left behind for a long time. And I want to thank them for the legislation that they carried, the budget amendments that they got across the finish line. And obviously we couldn't get any of it done without having a good partner in Governor Abigail D. Spanberger. Because I want y'all to understand, this is not the first time this legislation has come before the General Assembly and been passed. It's been vetoed. Let's tell the truth. She signed it. Give it up for her. She signed it. And finally, to Candy and Joshua, thank you for your friendship, your leadership, your unwavering commitment to Virginia families, and continue the fight, continue your voice, because we need it, and we're grateful for it. Now, it is my privilege. I get to keep introducing her all the time. Her Excellency, the Governor of the Commonwealth of Virginia, Abigail D. Spanberger.
Well, I need to begin by setting the record straight on one thing that Secretary Mundon King said. Nobody is the boss of Secretary Mundon King. To be clear. Thank you, Speaker Scott. Thank you to Sentara for hosting us today. Thank you, Secretary Figueroa, for caring so deeply as the head of the Secretariat of HHR, but as a human, as a person who understands that policy impacts people and lives, the physicians, the nurses, the medical providers who care for them. Thank you for taking that mission to heart in all of the work that you do today and every day. To the legislators who have been carrying these bills, who have been advocating, who recognize the need for change, thank you. Thank you. To the mayor, thank you for welcoming us to Newport News. To Delegate Price and Senator Locke, we are pleased to be here. This legislation exists because of your persistence, your compassion, and your refusal to let grief be the end of anyone's story. And so in that, I want to acknowledge and express my gratitude for Joshua and Candy and the entire King family. Thank you for being here. Thank you for your unwavering work on behalf of families like yours, on behalf of families who need advocates with voices as loud and as fearless as yours, to empower other little girls to be as empowered as our sweet Candace was throughout her life. Thank you for channeling your mourning into something that will protect and uplift thousands of Virginians for generations to come. And Delegate McQuinn said this is a model. It has to be a model for the rest of the country. And I promise you, throughout my time as governor, I will work in partnership with Secretary Figueroa to make sure that we are making it easy for other states to just copy and paste and pass bills that will change lives. The love behind these bills is visible in every single line of them. And these bills have been a priority of my administration since before I became governor. I remember When I called to ask Secretary Munden King to be the secretary, her first question was, why? Why do you want me to be the Secretary of the Commonwealth? To which I said, I thought we covered that in the interview. And then she said, yes, I'll be the Secretary of the Commonwealth, but I can't start until after this General Assembly session. And I said, well, that seems like a problem. Why? And she said, because I have to get our sickle cell bills through. And I knew what I think she knew in her heart, which is there's not a world in which the members of the General Assembly would not shepherd and fight and force every single one of those bills forward. And I said, and thankfully, I guess it was convincing, and I will make sure that every member of the General Assembly, not that y'all needed to hear it from me, will know this is a priority and that I will be ready to sign those bills when they pass. For too long, so many community members have felt ignored. Sickle cell disease has not received the research funding, the policy attention, or even the public awareness it demands. That disparity is not an accident of history, it's the product of decades of underinvestment in diseases that disproportionately impact and affect Black communities, Virginians, and Americans. More than 4,000 Virginians are living with sickle cell disease right now, and they manage chronic pain. They navigate a healthcare system that too often dismisses them. In some cases, they are driving hours to reach the nearest specialist. Some of them are students in our schools whose coaches and nurses may not know how to recognize a crisis. Some are patients in our hospitals who face bias, real, documented, consequential biases. And Senator Locke and Dr., forgetting your last name, ma'am, thank you for highlighting the very real impact. Because those biases, they shape the care that people receive, and that is not a system that is working. And the Commonwealth of Virginia has a responsibility to do better. And it's especially urgent right now because we are living in a moment when the federal government has been cutting the very programs designed to track and understand this disease. The Trump administration has dismantled the data collection infrastructure that researchers and policymakers depend on, and the safety net is fraying at the federal level for the study and the investment in sickle cell disease research, but other diseases that disproportionately impact Black community members. But today, Virginia is charting a different course. Virginia is choosing to lead through the Queen Candis Hope for Sickle Cell Act. And so let me tell you about a few of these bills. We are establishing the Sickle Cell Trait Awareness and Education Program at the Department of Health because awareness saves lives, and too many Virginians don't know that they carry the trait until it is too late. We're requiring school nurses to complete training on recognizing and managing sickle cell disease within 6 months of employment. For a student in crisis, that knowledge, it's not a nicety. It's the difference between a bad day and a tragedy. The Commonwealth is directing the Superintendent of Public Instruction to issue guidance to high school athletic coaches on the risks of sickle cell traits in student athletes. Our schools must be equipped to protect every student in their care. We are establishing the Sickle Cell Coordinated Access Network, connecting healthcare providers across Virginia with real-time consultation from sickle cell specialists. Because not every Virginian lives near a major medical center, but every Virginian deserves access to expert care. We are requiring bias reduction training for licensed physicians and nurses as part of their continuing education requirements. Medical bias is real, and it sometimes costs lives. Particularly Black lives, particularly in maternal and chronic care settings, and Virginia is now requiring the medical community to confront that directly and providing the tools to providers who have long wanted to do so. Today I'm signing a number of bills as part of a comprehensive legislative package. But before I do that, I want to take a moment to talk about a bill within this package that we are not signing today. HB 392 patroned by Delegate Alex Askew, establishes screening for renal medullary carcinoma, an aggressive cancer directly linked to sickle cell traits that strikes young Black men with devastating speed. Delegate Askew has asked us to hold that bill for a separate ceremonial signing because last week, his chief of staff, Dewan Stiegel, lost his battle with this terrible disease. He was 28 years old. Dewan spent the last year of his life fighting renal medullary carcinoma and fighting for this bill. He even came to testify before the General Assembly while undergoing chemotherapy just a few months ago. He showed up in the middle of his own battle to advocate for the young men who would come after him. Dewan will be laid to rest this Saturday, and to his family, his colleagues, Delegate Askew, and anyone who loved him, I want them to know that the Commonwealth of Virginia will carry his legacy forward. And when we sign his bill, Dewan's Law, we will do it in a way that honors the full weight of what he sacrificed to make it possible. This package is stronger because of him, and Virginia's sickle cell community is stronger because people like him refuse to stop fighting. And our sweet Candace, Gabriella King, she was a fighter too. She's 15 years old when she passed. She had a whole life ahead of her, and sickle cell disease took it. Not because medicine has nothing to offer, but because too many people with the disease fall through the cracks of a system that was not built with them in mind. Because of the King family's courage, because of what Joshua and Candy chose to do in the face of devastation, every school nurse in Virginia will now know what to do when a child with sickle cell disease needs help. Every athletic coach will know the risks. Every healthcare provider will be required to examine the biases that shape the care that they deliver. That is what it means to turn tragedy into action. Virginia was Candace's home. She grew up here, she went to school here, she was loved here. And today, Virginia is leading the nation. And we do it wearing pink because Candace was bright, and pink was her favorite color. And to the King family, to the Stiegel family, and to every other family fighting similar fights, Virginia will spend the years ahead making sure that the stories of our loved ones, that their stories will change what happens to thousands of Virginians who are living with this disease right now, and the thousands more who may be diagnosed in the years to come until we find a cure. That is the promise of the Queen Candis Act. And today it becomes law in Virginia. And with that, I would invite the King family, our bill patrons, advocates, to come forward so that we can get these bills signed.
I think I'll ask the General Assembly members and patrons of each bill to come, and members of the family, and then advocates for HB 1414, Delegate McQuinn, to also come to the stage. So if you have a little card.
That's a lot of
Please come to the stage. Thank you.
I will. This is free. This is free. Oh, yeah, she wants.
All right, up first, we have HB First up, we have by Delegate McQuinn. This bill directs the Virginia Department of Health to establish and administer the sickle cell trait awareness and education program. The program is designed to launch public awareness campaigns, distribute educational resources, and provide special healthcare professionals, school nurses,
Okay, back here in the Live Impact studio. That event obviously ongoing. They are having some audio issues, but we did get to hear very clearly Governor Abigail Spanberger speaking at the podium, and it incredibly emotional discussing this legislation. Brought to tears at one point. Now you see the legislation actually being signed. They have a number of different pens there. Those pens can become sort of commemorative items of the day and of the bill and of the history made, and that can then be given out, hence the multiple pens in order to sign her name. Okay, look at that. That bill is officially into law to create historic changes for sickle cell treatment, and obviously a bill that means a great deal to Abigail Spanberger.